Hello everyone and welcome back to Clinical Cousins YouTube channel, where today we're going to go over the basics of the QRS complex. Now the QRS complex basically is the combination of the Q wave, the R wave, and the S wave. We know already from our previous videos that the Q wave mainly represents interventricular septal depolarization, the R wave represents major ventricular depolarization, and the S wave represents basal ventricular depolarization. So together, the normal duration of the entire QRS complex is between 0.06 and 0.11 seconds. So we should know the normal progression of the chest leads if we are to truly analyze the QRS complex. Remember that the chest leads are looking into the heart to cut it into top and bottom halves. Also, because the chest leads or precordial leads are closer physically to the heart, they also have higher amplitudes, and we'll see why this is important in just a second. So normally, I've drawn this out in two ways for us to see. I've drawn what the normal progression looks like, and I've also drawn it in this way if you learn this way. So we know that the Q wave will start to appear in leads V5 and V6, also shown here. We've also seen that the R wave will have a steady rise or progression from V1 to V4 and then back down to V6. We can see this here. Steady rise from V1 to V4 and then slowly back down to V6. Also, we know that the S wave is present in all of the precordial leads or chest leads, but we know that it sort of tapers off from V4 to V6. Now, to be true EKG masters, we must also be aware of the height or amplitude of the QRS complex, and we must know what factors it is dependent on. So, the amplitude is dependent on the size of the vector, meaning how much electricity or muscle is present, right? More muscle equals more electricity. And it is also dependent on the direction of the vector. For example, if the heart was enlarged, it would have more muscle to generate more electricity. We would see a larger or taller amplitude, as shown here. Now, if we had some infarcted muscle or dead tissue, let's say that our ventricles become really weak, then these types of tissue, the scarred necrotic dead tissue, won't be able to generate electricity normally. Now, we will see a lessened or a smaller amplitude for our QRS complex on our EKG tracing. Now, we also have to consider the pericardium. Imagine that in the first EKG, our patient has a normal amplitude for all of his tracings, and now we simply have too much pericardial fluid or fluid that is surrounding the heart. This is called a pericardial effusion. So his heart is still generating the same electrical force, but these electrical vectors are having to travel through an ocean of pericardial fluid. It should be no surprise to us that when our patient's EKG tracing comes back with smaller amplitudes, we know that it is due to the sheer distance that these vectors have to travel to be seen by our EKG leads. So the same principle applies to patients who have a lot of adipose or fat tissue. Any sort of tissue or fluid that will create distance between the heart and the leads will decrease the amplitude. Now, we must know that tall complexes are usually due to these big hypertrophic ventricles, right? More muscle equals more electricity. Or it can be due to some sort of abnormal or slow conduction. A general rule is that the limb leads should be greater than 5 millimeters, meaning the entire complex should be greater than 5 millimeters in the limb leads, and it should be greater than 10 millimeters in the precordial or chest leads. If they are not, we say that there is a decreased amplitude. Now, why should the precordial leads be larger than the limb leads? Because the precordial leads are closer to the heart. Therefore, the vectors don't have to travel as much distance, and we can see a larger amplitude. Now, some important things to remember about the QRS amplitude is that younger, skinnier men will have greater amplitudes, while older, obese women have smaller amplitudes. And please don't forget that the chest leads will likely have greater amplitudes because they are closer to the heart. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.